Good afternoon, everyone. Welcome to the webinar. We're just going to give it a moment for people to log on and get connected. Good afternoon, everyone. Thank you so much for joining today's webinar. My name is Catherine Freeland, and I'm the Public Health Program Director at the Hepatitis B Foundation, and I'm pleased to present with my colleagues at Hep B United today's webinar titled The Impact of Hepatitis B on Native Hawaiian and Pacific Islander Communities. We have a great lineup of panelists today, but before we get started, I'd like to review a few housekeeping items and let you know how you can participate today. I'd like you all to share your name, organization, and location by typing in our chat box on your control panel. Throughout today's webinar, you can submit questions in writing or comments and feedback for the speakers in the question box or the chat box on your Zoom screen. We'll be reviewing them as they come in and hold a Q&A period at the end of the presentations. Finally, today's webinar is being recorded. You'll receive an email link to view a recording of today's presentation, as well as the slide deck for the session today. Next slide, please. Here's our agenda for today's session. I'd like to start by introducing our great panel of speakers. Dr. Nia Aitoto, who's the Senior Lead Consultant with the Pacific Islanders Center of Primary Care Excellence, is starting us off today. She'll be followed by Mick Del Rosario, who's the Program Manager at San Francisco Hep B Free Bay Area. And last but not least, Kenton Ali, who's the Director of Micronesian Education and Liver Wellness Program and a Hepatitis B advocate, will close us out today. And then we'll have some questions for the audience in the panel. Next slide, please. I'd like to also familiarize you with a bit of Hep B United in case you're not familiar. It's a national coalition that was established by the Hepatitis B Foundation to address and eliminate hepatitis B. Hep B United is dedicated to reducing health disparities associated with hepatitis B by increasing awareness, screening, vaccination, and linkage to care for high-risk communities. In the US, there are an estimated 2.4 million people chronically infected with hepatitis B, which can lead to liver cancer. Now I'd like to turn it over to Dr. Aitoto to begin today's webinar. Welcome.
Thank you. Slides. Okay, next slide. Okay, so before we begin, I just want to, give a shout out to Hep B Foundation for this opportunity, and mainly because we don't have a lot of this opportunity to talk about on a national level on, the impact of hepatitis B on Native Hawaiian and Pacific Islander. And for those of you who may not know, this is our homeland, and I'm going to refer a lot to where we come from, especially with a condition like hepatitis B, because it's very important in our discussion. Next slide. Okay, the U.S. for Native Hawaiian Pacific Islanders, it consists of for Native Hawaiian and Pacific Islanders, we have Native Hawaiians that are living in the state of Hawaii. They are Indigenous Hawaiians, Kanaka Maoli, but we also have territories that are part of the United States. So we have a different relationship with the United States. So the three territories, where one is a Commonwealth, is the Territory of America Samoa, Guahan or Guam, and then a Commonwealth of the Northern Mariana Islands. So they have a special relationship with the U.S. Through that kind of political definition as territories. And we have a history of colonization. And in the past, when we have a lot of health discussions on a national level, they focus a lot on, well, Pacific Islanders are living in Hawaii because that's the majority of the population, and maybe California. So in looking for data for these slides, there's not a lot of information or data, or not at all, about Native Hawaiian Pacific Islanders. It seems like the state of Hawaii has the data. And then we know hepatitis B is an issue, but not on paper or a lot of the data, right? Because they usually aggregate that with Asian Americans. And this is not just for hepatitis B. This is very common for everything else. So that's, one of our issues that we'll talk about later. But Hawaii, the state of Hawaii has one of the highest rates of liver cancer in the US due to undiagnosed chronic hepatitis infection among foreign-born. I know one of my co-presenters is going to talk more about that, but for me, it's just highlight the facts that it's not just here in the continent, but in Hawaii also, and then in the U.S. Pacific. Next slide. So the reason why I put up the COVID-19 slide is the importance of data disaggregation, right? Because we don't know what is the rate for everyone else. And then also I want to highlight and underscore the importance of looking at the continental US, right? Not just in Hawaii and then the US Pacific. So during COVID-19, I think COVID-19, what it brought us is a lot more awareness on infectious disease. So not only awareness for infectious disease, but a lot more awareness on communities like Native Hawaiian Pacific Islanders that normally don't show up on data. So this is a perfect example. When COVID-19 data first came out, Native Hawaiian Pacific Islands were not even on the map. So partnership with UCLA, they were able to separate out data for Native Hawaiian Pacific Islander, Asians, and then whites. And when we were doing that along the way, we noticed a huge difference, with all ethnic groups. So if you're looking at state where you normally don't think Pacific Islanders are there, like Montana, Louisiana, Illinois, even here in Arkansas, because I'm, calling in from Arkansas, Minnesota, you see like that top orange line, that's all Pacific Islander, right? So the importance of data disaggregation to look at a truer picture of who we are, right? So we needed like reliable and timely data, right? So in order to do that, we have to work with separate health departments, build our capacity to collect, manage, analyze, and disseminate. It's a huge project, and we're continuing to move forward with trying to disaggregate our data. But I feel like for hepatitis B, we need to prioritize that because there's a lot of discussion on a national level on data disaggregation, but they don't know where to start. So I see some effort there for diabetes and then cancer, but I haven't seen a lot of movement when it comes to hepatitis B. Next slide. So, and then, not just for Hawaii and then the continental US, we also need to make sure that we discuss our US Compact of Free Association, or COFA. So, for all of us, we, a lot of the discussion is here in the continent, but not a lot of data, US data from the US Pacific. Next slide. So we rely heavily on we have heavily on hepatitis B from the WHO Western Pacific region. So by looking at that, this is like the prevalence of hepatitis B. So if Australia is considered Western Pacific, so I use that as our reference point. And if you look at the COFA nations like the Marshall Islands, the Federal State of Micronesia, and Belau, if you look at those, it's much higher than 0.9%, right? From 7.8 down to 2.9. I also was looking at data from other countries where we're migrated from, like Samoa, not to be mistaken with American Samoa. This is the independent nation of Samoa, is 5.5%, and Tonga 14.8%, and Niue. And not just, these are just sample of the prevalence of diabetes, not diabetes, but hepatitis B in areas that we're working with. So the reason why I keep on saying diabetes is because I do a lot of work in diabetes, and in our diabetes management and all that, there's a lot more people coming in with hepatitis B and diabetes, TB and diabetes. So there is this overlap of people dealing with infectious disease and then also a chronic condition. So it's an issue where I feel like here in the U.S. We don't talk about it a lot, but it's a reality in the U.S. Pacific, and definitely hepatitis B. I do a lot of work in the U.S. Pacific also. Hepatitis B, when it comes to narratives in community, is a lot more important there. People are talking about it. There's some program, not a lot around hepatitis B, especially with diabetes and cancer, but not a lot here. So I feel like that's something that we need to discuss and then and change. Next slide. So what we did was, I'll spend a lot of my time here. So what we did is like we partnered with the Hep B Foundation just to conduct some, focus groups. So we started with the leaders focus group on, what is hepatitis B. So these are like, executive directors or leaders from CBOs, community-based organizations in Hawaii, and then here in the continental US. So we decided to start there. It's an ongoing project, and these are some of the results from that first focus group. The first thing is like we noticed a lot of lack of awareness and knowledge of hepatitis B. There were a lot of folks in the, in our focus group that they didn't even know hepatitis B is the English word for the condition. So they would know the name of the condition in their native language, but they didn't know you translate it to hepatitis B. So we spent a lot of time just talking about that. I didn't know it meant that and all of that kind of thing. They also, a lot of it was conflated because they were like, isn't that from alcohol? And so we talk about liver disease and that kind of thing. So there's definitely a need for linguistically and culturally appropriate information and then services. Another thing about hepatitis B, when we're talking about hepatitis B with the leaders, they continue talking about, chronic condition like like cancer and then diabetes, because in our day-to-day lives, right, that's something where we're addressing, and there's a lot more community movement around there. So definitely we need provide awareness and knowledge of Hep B to Pacific Islanders community, and then especially leaders. Also throughout their conversation, people were talking about their personal experience and connection, with hepatitis B, but there's no further action, right? So what I mean by that is like, well, my, brother-in-law had it, my family, my sister or something. They would just, the story started out that way, but it was just that, right? So, and it's very different from other arenas that I work in cancer and diabetes, where they will talk about that personal connection, but then they were moved to do something about it, right? Form coalitions and participating advocacy and all of that. So that was something where, I noticed a lot when they were talking about this connection, right? Between hepatitis B, their family and all of that. But also in this connection, in a community response, they always talk about back home. You know what I mean? A lot of their experience, or the first time they hear about hepatitis B, or whatever their, indigenous language call hepatitis B, they always talk about when I was a little boy, I remember somebody back home, but then they rarely talk about experience in hepatitis B here in the United States. And then when we move further into the conversation, people talk a lot more about stigma when they're having, hepatitis B, and also talk about sometimes it's taboo to talk about things like that, right? So people were talking, a lot more about that, but it also get me thinking about, data, when we have, especially for Native Hawaiian Pacific Islander, there's certain population within that umbrella term that have hepatitis B, or higher rates of hepatitis B than others. So we also want to be careful about the way that we talk about hepatitis B, right? Not to continue to, push on a lot of the stigma and things like that, but how to sensitively bring that up. But we also have in that focus group, we had a call right after, because we had another meeting with the same leaders. They talk more about what can we do as a community to remove that stigma and address it. And I felt like that discussion was very healing to a lot of people, and also it gave us a place to start all the other conversation, because it's an internal thing that we tell ourselves. The second thing is their connection to the homeland and then other health conditions. So they were talking about hepatitis B and especially cancer. So a lot of the folks that were mentioning hepatitis B, they immediately make a connection, right? They have the hepatitis B, but they die of cancer, right? And things like that. So they were talking about that, and they also talk about the reality of our community, where a lot of folks, they live back in the Pacific, but they come here for a while, then they go back. So a lot of this, migrants, so they just come here and then go back, especially with the territories and the COFA agreement, where we can come here anytime with no immigration issues or whatever, and then go back home and vice versa. So they talk about that. But if you're discussing the nature and infectious disease, right, that means that we have to really not just look at the continental US or focus on the US Pacific, but we gotta make sure, like, whatever our approach is, addressing the impact of hepatitis B, we have to make sure that we cover all three, because that's the way that we see the Pacific Islander, right? Pacific Islander living in the US Pacific, Hawaii, and then here in the continent. So they really were discussing the connection between homeland and then Hawaii and then the continent. And then with not just stigma and taboo, they also talk about fatalism, and I think fatalism is important, because in order for you to like think about like being active, like being aggressive and, come out and, advocate for something, or you have to have hope. You know what I mean? But if you have fatalism, like we're just going to die, it's a disease and all that, then we do not have that drive to change the condition and whatever. So I heard stories about that in the focus group and things, but it also related to political power, not just fatalism about the disease, but also fatalism around political power. Like, we're still less than 1% of the US population, nobody's going to listen to us, that wide resource and all that. So conversation moved from fatalism about the disease, but also power, our political power or advocacy power around how can we make this condition, change and all that. Very interesting discussion with our, with our leaders. And then the discussion then move on to the need for resources, to address hepatitis B, not just resources for Native Hawaiian Pacific Islander, there's a lack of resources, but also hepatitis B as a health condition, right? Because they were talking about, well, we have a lot more resources for COVID-19, of course, but then even before that, cancer and then diabetes and all that, but not around infectious disease. But and that's why they mentioning competing priorities, right? So you're talking to a community that is, very high hepatitis rates, but at the same time, we're dealing with, high rates of diabetes and a lot of, hypertension and cancer and all of that. So looking at the lens of, where does hepatitis B in this community, in our Native Hawaiian Pacific Islander community. So that actually, I could hear that in the conversation. And then of course, the need for NHPI specific data. So not just for hepatitis B, but for everything else, right? But if the community were like, in order for us to get the data, we have to advocate for it and all that. So I think the conversation then move on to, that kind of discussion. Next slide. So right now we're not finished with the project. Yes, we still have to do more focus group and discussion with community members, but we have not gotten into the point of making like firm recommendations of how to move forward. But in our Pacifica culture, we do reflection. So anytime you receive information like that as a Pacifica person, when I hear people have the discussion on hepatitis B, what we immediately go to is our own personal reflection of what does that mean. So this is just, it was not recommendation from the group, it was my own personal reflection of what I heard in those focus group, and also someone that actually do work in the US Pacific, Hawaii, and then here in the continental US. So, and then I hear this over and over. So I feel like the first recommendation is engage the community through various networks, right? That's everyone's recommended, engage the community on things like that. But a lot of time people are like, but where are they? Like, who are they and all that? But for the discussion was going more about like Pacific Island in local communities. We also look at it as a state or even as a region, whether it's a USAPI or here in the continent, Hawaii. And then there's also this national, approach, but then review, but then also international, especially with hepatitis B, because even though I'm based here in the US, a lot of the hepatitis B meeting that I attend is hosted by WHO or SPC, and that's all for the US Pacific, right? So I feel like there is a need for connection for the US API and then continents, because in the US Pacific, they also receive the same funding from CDC and then HRSA, there, but we normally do not connect the two. Of course, linguistically and appropriate information, outreach and services. So engage the community so we make sure like all of the things are not just translated, but it's culturally appropriate, but also the type of outreach, because we don't want to continue to marginalize the community, because of their hepatitis B status. But of course, they engaging community, we also can, reach out to help us with data, advocacy, and then policy. So I'm part of a lot of these national, we're bringing in a lot of local organization with not just by COPSI, the Partner Excellence, which is a health equity arm of ACTUAL, but also they have the National Association of Pacifica Organization, which is a national organization of all of these community-based organization from the US Pacific, Hawaii, and then here in the continents, right? So we have folks from like Tennessee, here in Arkansas, Oklahoma. So we're building that. I think COVID-19 gave us that gift of communities getting together, right? And that will be very useful when it comes to advocacy and policy, but then also resources. I always talk about, when it comes to our conversation around resources, we are resources also, right? Because I always feel like, okay, we're asking someone for resources, but there's a lot of richness within our community that haven't been tapped. So I feel like that's one of the reasons why it's important for us to bring all of these organizations together so we can tap into that. And then at the same time, they can reach out to us, to provide resources to them, because we do have a culture of reciprocity. So I think that's important. But then also I feel like that all of that discussion of stigma and fatalism, that, I feel like we really need to, whatever work that we're doing with hepatitis B, we got to make sure, right, there is a connection to address stigma and then fatalism, whether it's fatalism on your health or fatalism on political system or whatever. I feel like there needs to be something there. And then also, that connection to the homelands, and not just for the US API, but also, our brothers and sisters from Fiji, from Tonga, Samoa, and in the Cook Islands and things like that, because I feel like through migration, we do have that connection. So I think there needs to be a plan that include that. And then also maybe even make a connection with WHO, because they do work in the US Pacific on hepatitis B and then cancer. So, but there's no connection. And fatalism and political power, I feel like in that conversation, we do acknowledge that sometimes it is among us, for us Pacific Islander, to address our issues on fatalism. And when it comes to political power, we have to play the role of driving, agendas and things like that. So I feel like it is a work in progress, in those discussions. And then when it comes to hepatitis B, I feel like it is a good good step to reach out to community leaders here in the continental US and Hawaii. And I'm also looking forward to reaching out to our partners in the US Pacific. So by COPSI and then now, we do have a Pacifica Island gathering every year. So we bring in leaders and communities from all three regions. We bring them together to discuss stuff. And we never did, in all, we hosted 3 Pacific Island gathering, is usually annual before COVID-19 hit, but we never did talk about hepatitis B. I feel like hepatitis B should be on the agenda, and then with data like this and information, I feel like we can move that forward. And then our next Pacifica Health Gathering will be in the US Pacific, in the Republic of Palau. So I just want to put that out there if you guys want to visit or join. But for folks here who are championing hepatitis B, to make connection with us in the NHPI community. Next slide. Oh, and then that's it. So in community, thank you for joining us.
Thank you so much. Amazing presentation. And we would certainly love to join you for that, that conference. Great. So now we'll turn it over. I also, just a reminder, put in some questions in the chat as we're working through today. We're going to turn it over to Mick, who will talk about a pilot program at Hep B Free Bay Area.
Awesome. Thank you, Catherine. Hi, everyone. My name is Mick Del Rosario. I'm the program manager at San Francisco Hep B Free. And we have our Pacific Islander Liver Outreach and Testing Program, or pilot. Quick information, next slide, please. Thank you, Shreya. Thank you. A little bit about ourselves. So San Francisco Hep B Free Bay Area was founded in October 2017 as the official expansion of SF Hep B Free, which was founded in 2007. And with the expansion of the goal to expand to other Bay Area counties. The first target was to reach out to San Mateo County, which is south of San Francisco, with over 200,000 Pacific Islander and Asian American residents. And for our organization, we have partnerships between different nonprofits, government agencies, healthcare organizations, and advocacy groups as well. Our mission, here's the shorthand version, but the full mission for SF Hep B Free is to increase awareness and education about hepatitis B within the community and among healthcare providers, to increase access to affordable testing and vaccination, and also to provide linkage to care for chronically infected individuals. So, this pilot program is part of the work that we do within the San Francisco Bay Area as a whole. We also have an ECHO program where we educate physicians and primary care providers on hepatitis B through a peer education amongst each other. So what is pilot? Well, pilot aims to provide a community-based hepatitis B education, screening, and linkage to care to Bay Area Pacific Islander communities by partnering with local PI community leaders, where the program will make progress in this particular fight against hepatitis B and liver cancer. So for folks who might not be in the Bay Area, here's a quick snapshot on the demographics that we have. There are approximately more than 2 million residents at risk, and that's considering about 40% of the population of Alameda County, San Francisco, San Mateo, and Santa Clara counties combined. Generally, one reason is that the Bay Area, it's a very culturally diverse population, and with the Pacific Islander and Asian American communities making up greater than 20% of the population in many cities and close to 50% in a few. Point is, this disease affects our community, especially within the Pacific Islander and Asian American community. As you can see, Daly City, Foster City, San Francisco, all these different cities throughout. Oh, sorry, next slide, please. Yes, that what we have in pilot. Next slide. Bay Area demographics. Yes, next slide, please. Thank you. So we're partnering with Pacific Islander community and our allies. We have health navigators who are leaders within the Pacific Islander community that were recruited through Talama for Tongans, which is a local community organization in the Bay Area. And they also help provide advice and insight on best approaching and working with the Pacific Islander community. We were also able to get advice from staff from San Mateo County Health, which is the county's healthcare public health department in that area. And we also joined the Unite California network to provide program participants additional health and social services, which I'll be able to touch on in the next slide. So with this program we've experienced so far, we've faced a couple of challenges, but we're able to pivot. A couple of examples include the concern of COVID-19, in particular the Omicron variant, and the concern of having in-person workshops. Not as much as now because the wave seems to have been decreasing for now, but one solution we came up with was to host Zoom workshops as an alternative and holding in-person workshops as an option. So essentially having a hybrid model for people to participate in. With an online workshop, normally what we would have, if it was in person, we would have screening services for these workshops. But since it's online, it would be hard to get people to go out and get tested without being able to track them or just to see where they are in the process. So one solution that we came up with was partnering with this organization called Unite Us and Unite California, which is a coordinated care network of health and social care providers. These are participants in a network that are connected through online through a platform. where they're able to send these electronic referrals and help address people's social needs and being able to provide this holistic care and improving health across communities. So Unite California is sponsored by different organizations, including Kaiser Permanente, Blue Shield of California, several organizations as well. And what's great for participating nonprofits is that it's free because, again, you're able to easily refer and connect your clients to local services that they need. So it's not just hepatitis B, but also being able to get access to financial help, or also through educational resources. All these different kinds of social good and social services are able to be done through this platform. So this was a great way for us to have been able to get people to go out there. Next slide, please. So within the pilot program, a couple of our initiatives or our efforts we've done so far is being able to educate folks in the community directly and indirectly. This example we have over here was on March 23rd. Radio Tonga, which is Tonga's main commercial radio station. One of the programs we were invited to pilot. We're invited to pilot by one of the community leaders in San Mateo, Liafa, and we're able to feature some of our health navigators. And in this program, we were able to educate listeners about hepatitis B, this disparity of hepatitis B amongst the Pacific Islander community and pilot itself. And according to them, there are an estimated 3,000 listeners that tune into this program. So we were able to reach our indirect education goal in this regard. Next slide, please. Thank you. So for our direct workshop, we held one in Hayward, California, which is in the East Bay. This one was held at the Church of Jesus Christ of Latter-day Saints in Hayward. We had 18 attendees during this workshop, and this was during one of their community events where they were doing a practice session for their community, but we were able to have this workshop during their dinner time. One thing I found out during this workshop was that one attendee, shared that he lost his cousin from hepatitis B. And generally, one thing we've seen was that attendees were shocked about the statistics that we showed on the screen and how it particularly affects the Pacific Islander community. And we were able to fill out, or the attendees were able to fill a pre and post workshop survey, which is part of our program plan, because we want to see what participants initially know before having the workshop, and then being able to see how much information they're able to retain afterwards. Next slide, please. So findings we have so far is that data disaggregation is needed, especially in the Pacific Islander community. With the census and a lot of other designations, you generally see, AAPI, Asian American Pacific Islander. But one thing we're finding also, and one of the reasons we're having this program as well, is to make sure we disaggregate the data to make sure that the Pacific Islander community is more represented in these kinds of data sets. So that's why we have these pre and post workshop surveys to help build that kind of data to start on. Secondly, churches are a strong partner in educating members of their community. One thing we're realizing is that we need to go to where they're at. And in particular, I think I forgot to mention one part earlier about the challenge. If you can scroll back to the slide 6, please, Treya. There we go. Thank you. The last part was that one of the challenges we face is that navigators' availability are limited only in the evenings, because all these folks have full-time jobs during the day. But also one of the pivots we were able to do is going to events that are already scheduled where people are going to be at, and we would show up when we're invited. So that's one way we're able to help being able to be in the community by being where they're at already. If you can scroll back to slide 9, please, back to findings. Thank you. And the other main finding is that the community wants to have this kind of holistic approach to care and services. So it's not just, hepatitis B, just going here for this one particular issue or disease, but we're finding that because within the community, there are a lot of other services that could be provided to the community, being able to make sure that folks don't feel that just because it's just one organization or one disease that's being approached to the community, that it's just this one. And by us working with United California, we're able to help address that need of making sure that there is a more equitable approach when it comes to having these different organizations who come and team up with the Pacific Islander community, that make sure people have an overall well-being and overall growth in terms of their help and services as well. Next slide, please. So yeah, that's pretty much it. This is our additional information. So Richard So is our executive director. We have more information. You can check out our website at sfhepbfree.org. Next slide, please. And yeah, I mean, we're all in this fight against hepatitis B. So I'll just say thank you so much for listening.
Great. Thank you so much, Mick. Great example of effective programming. And we look forward to learning more as you guys have more outcomes coming out from it. Awesome. Now I'll turn it over to Kinson. Take it away.
All right. And so thank you for the opportunity to join the webinar this morning. So Hawaii time morning, and that's different in your time, I think. Yeah. And so micronation education. Oh, what's that? Oh, can you see that?
Yeah, looks great.
All right. Okay, so micronation education for liver wellness program is actually one of those joined about 80 non-NGOs and groups that are under FVOY. So we part of the consortium. And so the reason why is because I'm a survivor. I had my transplant in 2011. And so myself and my wife, who's a nurse, graduated from University of Hawaii, we decided to do our advocacy program to raise awareness, to increase awareness among our community folks here in the state of Hawaii. So here we are, continue to do that. Since 2015, we kick off the project. Okay, I'm stuck on this one. One moment.
I think it's not advancing, maybe? Kenzie? I think you might be on mute as well. There you go.
I'm trying to advance this slide, but kind of stuck on this one.
Oh, sorry. Let's see what we can do. If you want, you may be able to give us control of your screens.
Let me ask Director Thaddeus if he's there, if you can play on his side.
Thaddeus? Yeah, I think he is here. Let me see if he, if I can make him a host now. Let's see. Promote panels.
Apologize for that.
No problem. Apologies, guys, for the technical difficulties. We're having another individual join in and hopefully can share the slides with us. Hi, Thaddeus. Are you able to share the slides? Beautiful. Thank you so much.
All right. Next slide, Thaddeus, please. So we joining Free Hawaii in this strategic plan that for 2030 to eliminate hepatitis B in the States. So there's priorities and we continue to focus on awareness and education. That's our main area at this time. And we're very much covering actually that Micronesian community. Next slide. Okay, so there's again priority here, and that's strategic directions and elimination opportunity. So we continue to bring that opportunity to folks who are never knowledgeable about hepatitis B. Next slide, please. So next one, please. Okay, so our project, we continue to do that. And again, we do it online and we do it in person, especially during the COVID. We continue to do the whole session on a monthly basis to bring the word out to our community members. So we can be having with small groups or even churches or families. And again, that's a very effective way to move and be able to reach out to them through the Zoom and WebEx as well. Next slide. So the co-presenters speak about the lack of awareness and knowledge. So we try to work and partner with other agencies and for example, Free Hawaii, and then Language Access Hawaii. So we try to create some materials and make sure that they are all appropriate language and culturally, and to keep out and pass to people and bring it to our session when we meet with them. Next one, please. And we also do that in radio stations. And again, in group, we're bringing and partner with other resources and service providers. Again, I talk about Legal Hawaii, Legal Aid Hawaii Society, and also the Language Access Hawaii and AFRI as well. And other groups that, for example, we are Oceana. It's one of the non-profit organizations that we do a lot of language grouping and partner with them to be able to spread the word. Next. So we joined, we know that a lot of us, we coming from our places to states, we lack the education and so no knowledge about that hepatitis B. So we try to hold a monthly talk story, and then we go out to join their community sport event, church event, group family gathering and all that. And so we provide those incentives like food prices and things like that during the game. So this is one example of about 80 members of the tennis club for the Marshallese folks here in the States. So we join them and bring the word to them. Next one, please. And lack of access is very is one of the high challenges for us. So we try to go out and meet with the local and community leaders, and also the national level during the advocacy. And that is one of our photo that we took with Senator Macy Rona at Washington, D.C. office when we joined the advocacy the foundation that set up for us, and we were able to take part in that. So thanks for the opportunity again for those at the foundation folks. Next one. And so challenges, many of those that they lack of insurance and they don't know how to use the technology when we do the Zoom. And so that was one of the bigger challenges that we encountered during the COVID. So we try to do some creative ways to be able to reach out to them, teach them how to be connected, internet and online access at home. Some they don't have computers, so we have to find a way to make sure that they are having access to the computer and use their smartphone as well, because most of them, they have a smartphone. And when we found out they have like prescriptions for their medication, then we have to contact their specialist and doctor and try to link care to them as well. Next one, please. So we kind of put together some of our remedies, how we can be able to resolve, especially during the COVID, and be able to expand our outreach and also keep be able to connect with their PCV doctors and specialists, and like try to set up with the drugstore when to pick up medication, and we follow up and we do those kind of call and arrangement for them so that we have that availability medication for them. Next one, please. So this is kind of some of the suggests that we able to do 70 sessions, reaching out over 100,000 people. Just continue to do that. And again, this weekend, we are going to Maui, and we are ready to meet with the Marshallese community in Maui. They're hosting a softball tournament, and Free Hawaii and Micronutrient Education for Liver is sponsoring some of the event awareness session and doing group meeting with the teams and with the families, and we're expecting to reach more while we are in Maui over the weekend. Next one, please. So this is our contact information. We share our words of thank you, mahalo, and kilisto sabur, and that is our local Rensselaer. My wife is from Chick, and I'm from the Marshall Islands, so we're grateful to be partnered with Free Hawaii, Thaddeus, and the leadership that they have, Heather, Lotz, and all those. Thank you, and open for any questions then. Thank you.
Thank you so much, Kenzen. The work that you're doing is so inspiring, and I hope that it will also inspire others and encourage others to also work in their communities really at the grassroots level like you've been doing for many years now. So thanks for being here, sharing your story as always, and being open to sharing your experience with community outreach. I now want to open it up for the question and answer portion of our webinar. If you have questions or comments for any of our panelists today, I encourage you to insert those into your chat box or your question panel. We did have a note on Dr. Itioto. I think that you had noted that you are providing support to community health centers. Did you want to mention that and what you guys were working to host trainings?
Yes, we host training. I think one of our speakers talk about like Pacific Islander living with multiple conditions. So so we host training for community health centers. So it doesn't matter, because sometimes they put community health workers in silos, right? So say you handle diabetes or, you know, this kind of outreach. But what we're trying to do is to provide training to community health workers to do it all. Like, you know, we do cancer, like cancer 1, basic cancer, basic diabetes, basic hepatitis B and all that. So when they're talking to the community, they can at least say something about that condition and make referral. So we do those kind of trainings, you know, on site. We also do online training. And then we're working on starting back again national, you know, trainings. You know, COVID-19 took that off, but we're looking forward to starting up national trainings specifically for community health workers, but not only community health center-based health workers, but we also do it for CBO health workers, because we also find there's a lot of community health workers that are based in a community that are navigating people to the healthcare system. So,
thank you. And as others put in questions, I noted that a lot of you, most of you mentioned data as being a really big challenge in this space. Do you have any thoughts on what we can do as Hep B United to really work on addressing this? I know that's a really loaded question, but any suggestions that you guys might have would be really appreciated, I think.
Well, I don't want to take up space, but the others are thinking about the answer. For me, data has been a struggle for over about 30 years. So data disaggregation, but I feel like where the community discussion is, start local, right? So look at your health center on how data is collected, but then also how they report it, right? Because while we're working on the big data, national level data issues for Native Hawaiian Pacific Islanders, they feel like they can do something about talking to their community health center, even hospital, or even local health department to start not only asking like for separate Native Hawaiian Pacific Islander, but then also do it by ethnic group, but then reporting it out. So we also have a data and research council that address those kind of things. We're thinking about working on a toolkit for smaller health centers or organization to start help them collect the data, but then also how to report the data, right? With small, especially in areas where we're a small community, right? And I think the reason why we're trying to do that is because it's around stigma and isolation. We don't want to get stigmatized even further by this information, and all that. So so that's like data disaggregation on the local level, but then also for the federal government to because they are the one that giving grants, right, to states or organizations that serve Native Hawaiian Pacific Islander, but those organizations are not required to collect and report disaggregated data. So I think that we want to, it's more regulatory issue, but we want like a strong, in an RFA or something like that, saying that, if your program is serving, Native Hawaiian Pacific Islander, then, report their data separately. So I know our data and research council are working on recommendation on data disaggregation with the that we're going to push it up to the White House initiative.
That's great. Thank you so much for sharing that. And I think in the Hep B space, data disaggregation has really just been kind of a challenge that we've been dealing with a lot across the board. So really appreciate acknowledging that as an issue and something that we can work towards advocacy on. I want to see if Nick or Kinson have anything to add to that.
I think that's in our area, there's a lack of data collection. Absolutely, it's a challenge right now. And so I think since they're like receiving Combat Free Association funding through the federal government for their health services, I think they have to have some strength and kind of enforce data collection among our health services out in the Pacific, especially the Micronesian area. And also the POA organization here in the state of Hawaii, the leadership of all the directors from various Micronesian islands that are made up of the POA association here, or group here in the States. They need to start in, we need to invite them to join this kind of forum webinar so that you can have the opportunity to talk with them and share with them the concern that we all have and hear their, the side of how they're doing things and how far they go with the data and education and screening and all that. And so Marshall Island is one of the, I think that's very, very a great issue. One of the I challenge for them to try to start off and continue with their vaccine for the children only at this time. So that's from our site in the Marshall Islands. Thank you.
Thank you so much, Kenson. Really great suggestion there as well.
Yeah, I'll touch on that also. I think we're all hitting that same theme of, we need, long story short, we need more data. And for us at Pilot, we can only, even though we are collecting more data, these are individualized data. It can only go so far. And I think just, echoing what the two of them are mentioning, it's like, we need to make sure that we collect these kinds of, have a more of a collection of data, and also data disaggregation, which, in the blue sky scenario, hopefully that can be done on state and federal level as well. But hopefully with us being able to collect what we see by the end of this program in September, my hope is that we can see trends through that. But again, with the caveat that these are early data within the San Francisco Bay Area. So it'll be interesting to see in other parts of the country and other parts of the Pacific as well, where that can go.
Definitely. Thank you so much. Another question that just came in, how have your different organizations that you represent engage with Native Hawaiian and Pacific Islander community health workers, particularly those whose daytime jobs are to do specific healthcare navigation? Any thoughts on that?
I can touch on that. So some of our health navigators and pilot are working for San Mateo County. That is their day job. They run some parts of the Department of Health and during their daytime. The thing is, what I mentioned earlier during my presentation, one of the challenges for us, at least within our program, is that since their role as a health navigator is a part-time, in a part-time capacity, our events can only be done in the evening. And generally, because everyone else, or for the most part, a lot of other folks are having to work during the daytime. So the evening is the only time we're able to have these kinds of events and kind of education.
Thank you. Any other thoughts on engaging? All right, there's a question I'd like to, it looks like Dr. Yamanda, maybe to ask a couple of questions specific to maybe linkage to care. I invited you to talk if you'd like to unmute yourself.
Oh, hello. I'm Seiji Yamada. I'm from Hawaii. Hey, Nia, long time no see. Are there any, I guess my question is, are there any plans for clinical coordination between like U.S. Associated Pacific and clinicians in the U.S.? Because I think a lot of patients sort of get lost, in transit between the Pacific Islands and clinical care facilities in the U.S. proper. So having worked in some other areas as well, I do see some coordination between, say, like Hansen's disease units or tuberculosis units, but obviously those are mostly handled by departments of health, whereas hepatitis B care obviously takes place in a much more decentralized manner, in terms of who actually ends up taking care clinically for those patients. And so, yeah, therefore my question about coordination of care.
Yeah, great question. Thank you.
Hi, Seiji. I haven't seen you in a while. Good to hear your question. I've known Seiji for 30 years plus, I guess. But yeah, it's a great question, because I think that's a chronic, issue, right? It's like people go back and forth, right? They stay in Hawaii for 6 months, go back home for 7 months, and then come back. But then there's no communication between, let's just say, health centers here and then health centers there, or even the hospital or clinic. And that discussion actually came through in one of our, not hepatitis B, but our diabetes management, right? Because, with medication and that kind of thing. But I think what's going on right now is it's very relational, right? So if you know folks there or clinician there, then there's there's communication, but there's no formal plan, right, on this like national level to do that. I think the only hope that we have is like a lot of the community health center are working on electronic, medical records, right? Because I think that was one of the issue, right? Because it's like, Dr. Yamada, you work there, right? So they still have the charts, that's floating everywhere, but they are working on, transitioning to electronic medical records. So then maybe that'll be easier to do data sharing. Because I think in the past, a lot of the data sharing discussion was more around like how would the, information, like the chart will go from one place to another. But I feel like there's a lot more discussion around that. But I don't know if Melissa Leilani is still on this call, but so here in Arkansas, so the Arkansas Coalition of Marshallese, they're actually working on a plan, right, to have someone based in like, in Majuro or even Ebi to help, provide the information over, because I think that's another issue on a community level, right? Because you leave the islands and then you don't have your medical records, especially, immunization and that kind of thing. And then it's hard to get that record back. So as I was saying, it's like there's multiple approach, right? Hopefully we'll get to the level where clinician can just share data without, trying to get to know someone or get all of that stuff in through electronic medical records, but also community, it's interesting that I realized that community also identified that as an issue, not gaining access to their medical records, especially if they're seeing a new, clinician here. So.
Yeah, so obviously I'm a primary care physician. I'm a family doc, but and so this does relate to other things as well, including diabetes and any sort of medical problem of people that are going back and forth and such. But particularly with regards to hepatitis B, I'd be interested, Nia, if there's some way, if you're involved in some initiatives to try to set up some clinical sharing, if you could get me involved with that.
Yeah, yeah, definitely. I think that discussion is coming up now, a lot of that, especially with the electronic medical records that are coming up and focus on QA/QI, like because that came on in that discussion. And then, and also with community organization pushing it, right? So earlier on in my talk, I talk about the role of community in advocating for things like that. So even though it was like identified mainly by clinician and all that, community also recognized it and push, the envelope further, pushing the government to act or react and all that. So kudos to the ACOM team here in Northwest Arkansas for pushing that issue for Marshallese here in Arkansas, and then that go back and forth back to the Majuro and Ebi and the Outer Islands.
Thanks so much, Nita. Yeah.
And I did add Melissa Leilan. I know she was referenced. If there's anything that she would like to add, Melissa, feel free. Give her a minute. I know Dr. Stuart Fong also had a question. Stuart, feel free.
Hi, yes, this is Stuart from SFFB Free, working alongside with Mick and his great work that he's doing. So the question is, it's probably hard to get data disaggregated in the US, but does the HHS Region 9 have data in the Pacific Islanders? Because they are responsible for those islands, so they have to have some health data that we could use from their homeland and extrapolate that and use that as a modeling for here in the US. Have we tried asking HHS about data?
That's a great question. I don't know the answer to that personally. I don't know if any of our panelists may know the answer to that, but it's something we can look into.
Yeah, for someone that works in a region on, hepatitis B, diabetes, cancer, and all of that kind of data, I feel like data in the Pacific, it's also, the reliability, because they will collect data for the hospitals or even clinics, but I think the data management analysis. So there's there's a lot of other issues when it comes to data for the US Pacific, and a lot of the reports that we're seeing right now, most of the most of the data came from like reporting, like if you get money or funds for this, then they will submit that report over, and it's very in silo. So so it also depends on who's collecting that data and who's reporting it out here. And then I feel like that was one of my recommendation early on, right? Talking about giving grants to to not just the US Pacific, but then here in the US, right? On how to do reporting, right? So so the data issue, we've been talking about it for a long time, and it's in silo. But I feel like there's a need for that, right? For a need for like, something like HHS to have more requirement for data reporting, but then on the bigger picture on how to put that together or, separate them apart, and then how to report it to the community. But it's very hard, like even like during this presentation, we got data from WHO, right? But then no data for hepatitis B. But I do work with cancer programs, in the US Pacific, and they do recognize, hepatitis B is an issue and they need to address it. However, hepatitis B is not a priority for the cancer program, right? To collect data or anything else like that. So they don't have that data there. So it's a complex issue. And I'm glad that we do have a data and research council that's starting to think about this issue and then really just dissect it and figure out how to work with it. But I don't want to call out Sam Wu, but I saw him here also to see if there's any movement around data. So I don't, it'll be nice to be part of that conversation because that's something where we need.
Definitely, thank you. And I allowed Sam Wu to also speak if he would like the opportunity. Hate to put people on the spot like that, but we have the opportunity here. Okay. Well, that's something, certainly for us to continue thinking about, following up and advocating for. Definitely the need for more data is certainly present in this space. But I want, just in the interest of time, I know we had an hour for our conversation, so I want to be mindful of everyone's time, particularly our panelists. If you have any questions about anything that we discussed today, you can always reach out to us at Hep B United or info@hepb.org. We're happy to connect you to some of the panelists if you have any particular questions for them. I just want to thank our panelists again for their amazing presentations and sharing all of their research and work that they're doing on the ground in the community. It's amazing to see this work, and we hope that it can continue to be replicated in various communities across the US. But I want to thank all of you, our attendees, for participating as well and for your great questions and discussions. We will be sending out a recording shortly, so look out for that. And I believe that there is also an email, or there will be a survey link after the webinar for your feedback as well. But I want to again thank our panelists and thank you all for attending. And I hope you guys have a great rest of your day. Thanks, everyone.
Thanks, everybody.
Thank you.